Welcome back to the Canadian Concussion Center's webinar series, which is sponsored by LIUNA, the Labor's International Union of North America. This is actually our last webinar prior to our fall series. My name is Leslie Rattan. If you've been here before, you have seen me, and I'm pleased to be moderating this series, which was developed for people that have suffered from a concussion, from their caregivers and family, as well as healthcare providers. And our sessions focus on various aspects of concussion. And we usually start with a presentation from our expert speaker, and then we open it up to you to ask any questions and get those answered by our speaker. Normally, our sessions occur every Tuesday evening, and we will be restarting in September. So we'll speak to that towards the end of tonight's session. I'd also like to just acknowledge the Indigenous peoples of all the lands that we are on today. Even as we meet virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast to coast, we honor the ancestral and unceded territories of the Inuit, Métis, and First Nations people who call this land home. Just before I forget, just in terms of the Q&A, if you do have a question, you can put that in anytime. And I already see one in there. Just if you scroll to the bottom of your screen, you'll see Q&A. So please put the questions in there. If you have any technical difficulties, please enter those into the chat. You'll see that Christian has very kindly put in the link into the chat if you are wanting to access any of our prior presentations. All of them are recorded, so you're able to access them. And finally, we're just going to run a short poll just to get a sense of who is in the audience. So I'll just give it a second for Christian to pull that up. Perfect. Thank you. So I'm really pleased to welcome back Dr. Carmela Tartaglia. She has asked me not to read all of her bio, so I will just take a few statements here selectively. So Dr. Tartaglia is a professor and clinician scientist at the University of Toronto. She maintains a cognitive behavioral clinic where she sees people with neurodegenerative disease and persisting concussion symptoms within the UHN Memory Clinic. And I think that's all I will say. I'm going to turn it over to Dr. Tartaglia.
Hi, thank you all for joining. And I guess we will get started. Okay, so let me just make sure I have the right one. And okay, so we're just gonna go over a few myths and non-evidence-based therapies that have that are being promoted. Concussion used to be an area where there really wasn't much interest, but in the last few years, there actually has been a lot of interest in concussion, which is great. But at the same time, that means that a lot of misinformation has creeped out. And so we'll just go over, what things that are kind of better established, let's say. So we're going to talk about as the myths and facts relate to diagnosis, treatments, and some long-term consequences. So first myth that I still hear, but luckily a little bit less, is that you have to lose consciousness to have a concussion. That is completely false. Most concussions actually do not result in a loss of consciousness, and a brief loss of consciousness can occur, but it has to be very brief. And some people can't remember the event, so they can have an amnesia prior or following the injury. And this could last for a period of up to 4 hours. And it's called post-traumatic amnesia. And so sometimes people will forget, they've had a car accident, but they forget how it happened, like what happened in that moment, or they kind of awaken and people are tapping on the door, on the window, but they don't actually know how the accident occurred. And some people feel dazed or confused. These can all happen, and they're all associated with concussion. Another myth that I still hear actually quite a lot is that there's a direct relationship between presence and duration of loss of consciousness and concussion severity. So there is actually no relationship that is very clear. And so, a brief loss of consciousness doesn't necessarily correlate with concussion severity. People have no loss of consciousness and can still have concussion and very prolonged symptoms, and they could be very significant symptoms. Um, s- just to say that, of course, if people have very prolonged periods of loss of consciousness, we usually, expect that that's going to be a more severe injury. But otherwise, there's no clear relationship. Another myth, concussions only result from a direct blow to the head. Again, this is not true. Concussion can be sustained by a sudden violent movement of the head, and that can be caused by an external force to the body. Whiplash injury can also cause concussion, so you don't have to hit your head at all. But if you can imagine, like, just the your forward and backward flexion of the head really does a number on the brain as it jostles it. A concussion is not a brain injury. This is a myth that actually has managed to persist, let's say. And the problem is that because people don't think of it as a brain injury, whether we call it mild traumatic brain injury or we call it concussion, the problem with this is that people don't have enough reverence for this injury. And so, I think people need to realize it is a brain injury. Doesn't mean it's, going to last forever, or people heal from injuries, but that it is a brain injury, and the symptoms that come about because it is a brain injury. So like I said, concussion is a mild traumatic brain injury. Some of us are not crazy about the word mild traumatic brain injury, and that's because when we put mild, it's people sometimes think, well, it's that how bad could it be? It says it's mild, but it is a brain injury, whether it's mild. Obviously, mild is better than having a moderate or severe brain injury, but nonetheless, it is a brain injury. And the signs and symptoms that come about are the result of an alteration in the brain. Another myth is that sports related concussion impacts can't be compared to motor vehicle accident impacts or other causes of concussions. We actually don't have any evidence for that. You can think about sometimes the severity might be worse if you've had like a, multi-vehicle crash, or, your head has gone through a windshield or hit the steering wheel. But there's nothing about the concussion itself that necessarily makes it any different. And so we now at this point think that sports-related concussion studies indicate that concussions across multiple mechanisms of injury are comparable. All concussions are the same is another myth. There are many variables that influence the outcome. And so things like sex and gender, the number of previous concussions, age, other medical, psychological problems, stressors after concussion. So it's important to expect that there's going to be variability in outcome. And so there's can be a whole different host of symptoms in one person compared to another one. The length of recovery is different. There are certain patterns that we see. And so we do expect, sometimes, we expect that most people who have a concussion have headache. That, if you have headache and sleep problems, then, you probably are going to complain about, your cognition, your cognitive function not being as great. If it lasts a certain time, that you have headaches, you could become anxious about it. So there are patterns that we see. Um, Most people get better. That's the fact. Another myth is that injury to the brain occurs only at the initial impact of the concussion. Well, we don't really have a good understanding of what changes at the brain level when you have a concussion. And some things that can change at, at that, what we call that acute phase, right, can also cause changes that, maybe like trigger something that, take that that is delayed. And so it isn't an injury only at the initial impact. And so concussion is an evolving process with many changes that occur in the brain and evolve over hours, days, weeks, and months after impact. It's important to protect oneself against another concussion while healing from the concussion, and that's why it's important to this whole idea of resting wasn't because it's good to rest. The whole point was to actually protect yourself, to get yourself out of harm's way by not doing an activity that would put you at high risk of another concussion. What about concussion diagnosis? This is one area where, there's a lot of myths. One of them is that a SPECT scan can diagnose concussion, an EEG can diagnose concussion, and a blood test can diagnose concussion. Currently, so today, there's no established diagnostic tests for concussion. This is a clinical diagnosis. So that means you need a person to tell you that some event happened, that where they had this, whether it was force directly to the head or to the body that got exerted to the head, and then they developed symptoms afterwards. So like I said, it's a clinical diagnosis, and an MRI or CT can be used to rule out a more significant injury, but it's not there to diagnose concussion. And there's lots of research in this area, but nothing established as a clinical test. There are some blood tests nowadays that are good for identifying more severe injuries. And so you can, people are starting to try to put together combinations of tests to see about being able to diagnose a concussion. And so I am optimistic that this is not too far away, but it's just not here today. And a lot of people will tell me, well, Health Canada has approved this or the FDA has approved it. They've approved that something is safe. It doesn't mean that it works. And so this is the same for therapies. This is for the same for these tests. In many cases, when when something is Health Canada approved as a treatment, it's very clear that that is got the kind of scientific proof that it will, help in the area that, you're looking for treatment. But if Health Canada approves a device as being safe, they're just telling you that it's safe, that it, doesn't hurt you, but it doesn't have anything, it doesn't really look at whether it's actually working for what you need it to work for. Another myth is that males and females have the same chance of sustaining a concussion. Actually, females have a much higher risk of suffering concussion, whether it's in sports and motor vehicle accidents. The causes of that difference could be hormones, could be neck muscles. Some people have proposed that it's because women are more likely to report, so more, maybe a gender issue. So another myth is that athletes will acknowledge when they have a concussion. Athletes want to play, so they need to be educated on the consequences of playing with concussion, especially their risk of a second impact symptoms or second impact syndrome. We have Rowan's law in Ontario, and this was because Rowan Stringer was playing rugby and she sustained a number of concussions over a very few number of days and ended up with what we call second impact syndrome and died. So it is important to avoid another concussion while your brain is trying to heal from the first. As well, it puts you at risk of more prolonged symptoms. Another myth is that a player that gets dinged or bell rung or seeing stars hasn't suffered a concussion. But actually, those are all words that people use to refer to let's say a physiological or neurophysiological event that really is the same as a concussion. And it puts you at risk of sick and impact symptoms. It puts you at risk of more prolonged symptoms. Any stunned, confusional state is considered a concussion, even if the symptoms may only seem to last for a very short time. And symptoms of concussion can become apparent only later. Sometimes people are very excited or they have an adrenaline rush. And so sometimes there is a delayed onset of symptoms in athletes. So it's essential that a player who has any confusion be removed from play and reassessed within a few hours. And I always tell people, your judgment also lives in the brain. And if you've had a hit to the head that, makes you unsteady or woozy. Sometimes people complain about a vision issues. Then you could imagine that your judgment might also be affected. And so, when we ask players if they're okay to play, and they've just had a hard hit, we're not really doing them any service. We should actually be removing them, and some of the professional leagues, such as the NFL, have spotters who, if they declare that somebody has been hit, the player is removed. They're not even asked whether they're okay to play. And I think it's important that we use that kind of approach throughout all the different leagues, not just at the professional level, because obviously, everybody needs to be protected, especially children. When you see a child getting a hit, where they fall, of course, they're so happy to be there, and they're, if they're not crying because of a really bad uh, of a bad injury, they probably excited to be there, but it's probably not the best thing for them to leave them out to, at risk of another injury. And you have to think that after a concussion, one of the symptoms is that people feel unsteady. Could you imagine if you're playing a sport or doing any activities that put you at risk, at even greater risk of suffering a concussion or a greater risk of falling, and then that could really be detrimental to your health. Another myth is helmets and equipment will prevent concussion. Helmets don't protect against concussion. I know those guardian caps that some of the footballers are wearing, they're hopeful that they will prevent concussion. But helmets are good for protecting you against a moderate or severe brain injury. But really, when you think about a concussion, the brain is still jiggling around, whether, maybe the force will be slightly less if you have a helmet, which obviously is important, but no matter what, your brain's still getting jiggled. Like I said, the helmets are protective though against more severe brain injuries. And as of today, we don't have devices that protect against concussion. And again, when the Health Canada or FDA approves something for safety, it doesn't equal efficacy. Signs and symptoms of concussion are always apparent immediately after injury. So most of them are, but not all of them. So the symptoms can appear up to 7 days, usually before. And some of this is because of shock. Also, it isn't infrequent that patients will have pain from other injuries. You can think of if you're in a motor vehicle accident or you're falling from, you down the stairs or something. You could have pain from other injuries that are actually, more maybe requiring more of your attention at the time, but you only notice as those other injuries resolve that you actually have some symptoms related to this concussion. Another myth is that males and females recover at the same rate. Actually, females are more prone to persisting symptoms of concussion. They have a slower recovery. Some evidence that this relates to hormones, because premenarche and postmenarche rates are similar to males. Um, One of the myths that I still see, although luckily it is being reduced, it is reducing, is this need for prolonged rest after a concussion. Like I mentioned, this probably came about because people were trying to get, you know, sports athletes out of harm's way, or out of the risk of a second concussion. But there is no evidence that you need rest after about 48 hours after a concussion. Um, the do not return to activity where a concussion occurred if at high risk of subsequent concussion is obvious to I think most of us. And the evidence is actually that aerobic exercise is like sub-threshold aerobic exercise speeds up recovery from concussion. So there are protocols to help patients exercise without exacerbating symptoms, and that low level symptoms are not harmful, and outweigh the benefit of the aerobic exercise. But obviously you don't want to have like major setbacks. Another myth is that you can't sleep after a concussion, but it's not a factor in my other post concussion symptoms. That is not true. Firstly, sleep is often affected after is often changed after a concussion. This is very, very common. And the fact is that sleep is a very important factor in cognition and mood. And so poor sleep causes concentration problem, causes memory problems, and of course then people get more anxious, and that makes your sleep even worse. So you really end up in a, you know, vicious cycle. As well, obstructive sleep apnea is very common, and it's very common in those with persisting symptoms that have gained weight and snore. So, sleep apnea is a serious condition and needs to be treated. And of course, sleep apnea is associated with poor cognitive function. It's also associated with headache. And so it is very important to get assessed and manage this. Another myth is that depression and anxiety that happen after a concussion shouldn't be treated, as they aren't the main problem. This is completely untrue. First of all, depression and anxiety are frequent symptoms of concussion. And when they're left untreated, they actually interfere with the recovery. They impair your cognition. So you'll have, if you have depression and anxiety, your memory isn't very good. You can't concentrate, affects your sleep, and obviously that makes your cognition even worse. Anxiety is a great emotion for running away from lions, getting away from those predators. That's what allowed you to survive. But if you have anxiety during the day, well, and there aren't any lions, hopefully, running after you, well, you're going to go into the same state as when the lions are chasing you. And that's a state where you got to get away very fast. You're in the flight mode. You aren't really, your brain's not in a state of, registering information and processing efficiently and trying to remember things. No, the brain is just all about, I got to get out of here. And so being in an anxious state is actually very bad for cognitive function. Another myth I often hear, and it baffles me because I'm not sure where this came from, is that antidepressants are addictive. Antidepressants are not addictive. Treating depression, low mood, anxiety actually improves cognitive function, and so people recover faster. um, and and not treating depression actually contributes to having people have more prolonged symptoms. And these medications, a lot of times we use them for really short periods. It's more to get the person out of that kind of slump that they're in, related to the concussion. But a lot of times patients in my clinic would go on an antidepressant after a concussion for 6, 7 months, 8 months, and then they come off of it because they're doing okay, and they're not really in that state anymore. And so I am worried when people are really reluctant to take any medication to treat their depression. To me, that would be like not wanting to take insulin to treat your diabetes. Of course you will just get worse, and there'll be damage to other organs, that would be damage to other things in your body because of the fact that you're not treating your problem. Well, the same thing is for depression. Not treating depression, your sleep is bad, your cognition is bad, your pain gets worse. So it's very important to treat it. Another myth, I mean, it's not a myth in the same sense that it's not true, but people will tell me that cannabis, CBD is helping my anxiety, is helping me sleep. But the problem is that those aren't treatments for anxiety, for sleeping. These are treatments that are being used for these indications instead of actually getting the right treatment. And so, and the concern is always that these things can be addictive. The issue is that you aren't actually treating the anxiety. This is just, this is kind of masking the anxiety. So instead of taking some, serotonin selective reuptake inhibitor for anxiety, you're taking cannabis, but the SSRI might be helping, reduce your anxiety by a pathway that can help your anxiety. Cannabis is kind of doing it in a way that maybe dulls the system, so you don't actually notice as much around you, but this is a concern. And cannabis, CBD oil, THC, these are addictive. And cannabis can affect cognitive function, and they have been associated with psychosis and low mood. And so, it is concerning that people are using, cannabis to self-medicate for anxiety and sleep problems. Another myth is it's okay to take Tylenol, ibuprofen when I get a headache, uh, and that you and sometimes, and this comes about, I think, because sometimes people will go to the emerge or go to their doctor and they're told, well, if you have a headache, take some Tylenol, ibuprofen. But there is a problem if you're taking too much of this stuff. Another myth that I hear is that you shouldn't treat a headache from a concussion with medications because it may mask the symptoms. Well, the fact is that headaches need to be treated. Headaches are very common after a concussion, and if you just let them be, um, you know after a few weeks, fine, you let them be, and hopefully they get better. But after 2 3 weeks of having headaches, I don't think you should be letting them be. The issue is that if you take Tylenol, ibuprofen, and any other such analgesics for more than 14 days in the month, you actually give yourself medication overuse headache. And those are very difficult to treat unless you get rid of those analgesics. Headache prevention medications are very effective in many patients to prevent and cure post-traumatic headache. There are a number of agents that are first-line agents that we use, but as well, there are actually a number of new medications that have come out and are being touted as like marvelous for headache prevention. So, people shouldn't be tolerating being in constant headache or frequent headache because they're don't want to take something to prevent their headaches. Usually the headache prevention medications are taken for a few months, and this helps resolve the headaches, and then people go back to their pre-concussion headache state, and so they don't need these medications. So another myth is I have visual problems, blurred, pain, dizziness, and I was prescribed vision therapy and it is supposed to help. Actually, there are many visual symptoms after a concussion. Can be double vision, blurred vision, avoidance of near tasks, reading difficulties, illusory motion, sensitivity to visual motion, intolerance of complex environments, and sensitivity to light. However, there's no evidence that vision therapy works for post-concussion visual symptoms. There's a lot of work being done in this area, And I'm certain that eventually we will get to, the right therapy. But right now, I see a lot of patients who have tried vision therapy. They've actually spent a lot of money on it, and it hasn't helped them. I think there is evidence for strabismus, for vision therapy and strabismus and the lazy eye, and probably other indications. But for concussion, the research really isn't that great. And like I said, it does have uh, evidence in certain diseases. Another myth is I can't return to work as I am not back to baseline. My lawyer said my compensation will be affected. My lawyer has said that I need such and such therapy. So, you know, there's a few problems with this. So, well, first of all, there's no there's no rule that you have to be back to your baseline to go back to work. Uh, a lot of workplaces, and most workplaces, should be able to provide some accommodations. Now, there are obviously some jobs with difficult to accommodate, so that's something else. But most jobs you can accommodate. Um, Secondly, one of the issues is that your lawyers aren't uh, medical people. They're not physicians, they're not nurse practitioners, they don't have any expertise in this area. And so they really shouldn't be guiding your therapies. They should be focused on, the legal aspects of your case. So, like I said, lawyers are not medical practitioners. They should not be prescribing therapy. Returning to work is actually associated with better recovery. So every attempt should be made to make a graduated return to work. And you don't have to be at 100% to return to work. It's okay to return with accommodations. And people who return to work actually do better in the long run. So speak to your employer and your medical practitioner to try to get a return to work plan in place. Another concussion myth is that there are no long-term effects of concussion. Actually, if symptoms of a concussion aren't treated, then they can result in prolonged concussion symptoms that can affect cognitive function like memory, concentration, physical function, physical aspects like headache, dizziness, and of course emotional functioning like depression, anxiety, PTSD for many months to years. As well, concussion and mild traumatic brain injury have been implicated as a risk factor for chronic traumatic encephalopathy. This is the disease that has been described in, various sports, and in the military, a few cases of intimate partner violence, as well as a recent report from our group found, a good amount of uh, disease in um, homeless people. So concussion has been implicated as a risk factor for chronic traumatic encephalopathy, Parkinson's disease, Alzheimer's disease, ALS, and frontotemporal dementia. And so, we are concerned that concussion can be associated with a neurodegenerative disease, but it isn't, like a one-to-one, right? So it's not that, well, if you've suffered a concussion, for sure you're going to get one of these diseases. That's what it means when we say something is a risk factor. So brain injury, all brain injuries, including concussion, have been implicated in dementia as a risk factor. But we all know, that smoking is implicated in lung cancer and is a very serious risk factor, but not everybody who smokes gets lung cancer. And so it is important to remember that. It's also important that, if you've been subjected to the risk factor, that maybe you should be doing a lot of, the things that we know are good for the brain so that you can actually kind of counterbalance this risk factor. So the right now, the evidence is quite convincing that it is only repetitive head impacts that happen over years that really put you at risk of chronic traumatic encephalopathy. Um, but the biology of the relationship actually is an active area of research. So we don't know how a concussion, can even evolve into a neurodegenerative disease and why it evolves that way in some people and not in others. Um, what about treating concussion? I think it's important to remember that concussion basically causes a lot of different symptoms. And so some are cognitive changes, some are headache, some are the physical changes like headache and fatigue and sleep issues, and some are mood changes like anxiety and depression. And so, you can kind of think of the concussion as, stopping the gears in your brain. And then, the therapies, whether they be for mood, for headache, or for sleep, is basically to get the gears going again. Because, a lot of times when you fix one of these, uh, you know, like one of these symptoms, you actually can help a lot of other symptoms. And so to summarize, there are many myths circulating about diagnosis and therapies related to concussion and persisting symptoms of concussion. You need to be critical of all the information you receive. There's much research being done in concussion, so every day we learn new things. We can stay on top of this, and you can look for reliable websites such as, the Brain Injury Associations, hospitals, universities. um, there are many treatments for the symptoms related to concussion, and treating these symptoms actually improves outcome. Aerobic exercise helps recovery, so we want people to do low impact aerobic exercise. And, returning to work, school is really good for recovery. So you want to work towards this as soon as possible. And sometimes, you can go back earlier with accommodations. And these are just a few resources for getting the right help. And that's it. We'll stop sharing my slides. I think there's a few questions.
Yes, there are. Thank you so much. An excellent presentation. Okay, I'm going to start here. Jim is asking, they say that learning an instrument is beneficial to TBI and recovery. Would learning two instruments be more beneficial?
I love that. Yes.
Yes.
The more you learn, you should be learning new things every day. That's, just part of brain health, because obviously a person wants to recover from a TBI, but they also want to be thinking about brain health in general, even if you haven't had a concussion or a more significant disease. And that is that we now know that learning new things, being in challenging environments, being challenging environments in the sense of, cognitively challenging environments, is really beneficial to the brain. And this is, you're banking this for the long term.
Yeah, absolutely. Thank you. Just a reminder as well, the questions are coming in, but if you do have questions, just put them into the Q&A. Okay. So we've got someone that's saying they're going on 14 years post TBI with persistent symptoms. At the beginning, it sounds like a neurologist saw small brain bleeds, said nothing to be concerned about. Recently, they were told that even small bleeds are an indication of PCS, that may be long term. Is there any truth to this?
Yeah, so one of the things to note is that, so when we see brain bleeds, and obviously, I can't look at your scans, those are microhemorrhages in the brain. Okay. Usually those are seen when it's more significant than a concussion. So we would already start to think of as this more of a moderate to, more of a moderate brain injury. Or is it, like the more severe of the mild traumatic brain injury? Because, usually by definition, when we talk about concussion and mild traumatic brain injury, we don't see anything like microhemorrhages in the brain. Now, the fact that they saw that and does, say that, I would say it's a more significant injury, then there is always a risk that it could be a more prolonged symptoms. I do want to say one thing, and that is, and I can't, and I don't know about your scan. The fact that a person has microhemorrhages in the brain can also be seen in other conditions. And it doesn't preclude that a person can't improve, that they can't have good quality of life, good cognitive function. It really is depending on what symptoms the person has and how amenable those symptoms are to treatment. Because we have patients in other, outside of traumatic brain injury who could have hundreds of microhemorrhages in the brain and still can have a good quality of life, and we can deal with many of their symptoms but not all of them. Yeah, hopefully that answers your question.
Great. Thank you so much. Is it true that concussions can be related to inner ear pain? They're saying they can't even wear earbuds. Could the ears, headaches, etc., be related to jaw or TMJ issues?
Yeah, I mean, you're right in the sense of, when we say headache, right? We call headache, it's like head pain, but that's means different things for different people. And so, one reason that people do have headaches is actually because of their temporomandibular joints, right? So their TMJ joints you will lead to headaches. So you can have jaw pain that, leads to a feeling of head pain. And so, yes, anything in your inner ear that is hurting, can be, it can feel like it spreads. And so, yeah, I would definitely get that evaluated.
Great, thank you. I'm going to combine the next couple of questions. They're related to headaches. So, after many years of post-concussive daily headaches and trying three different medications that either didn't work or have side effects that necessitated them stopping, what else can I do? And then someone else is asking, what are the new medications for headaches?
Yeah. So, um, there are there are at least there are four first line medications for headache prevention that have been kind of around for a very long time. If you haven't seen a headache specialist in the last, I would say, 2 years, you should go back, because in the last few years there's these calcitonin receptor antibodies that have um, come into the market and have basically revolutionized headache management, because they're so effective. There's new medications that have come on the market for acute, like let's say when you get the headache, but there's a number of them that have come onto the market that are for prevention, and their mechanism of action is completely different from what we've had in the past. So I would suggest going back to a headache specialist if you haven't seen somebody recently.
Great. Okay. How important is the neck and what treatments are helpful for this?
Yeah, I mean, the neck is very important. You can think of, like, if you have a whiplash injury on top of a concussion, that could really set you back, and, you need to have that neck addressed. So very important. If you have neck pain, it would be worthwhile to see a physiatrist who can evaluate that. You can also, I mean, obviously physiotherapy can be useful, but it's good to get somebody to think about what is the injury, right? Like, was it a whiplash injury? Is it just a strain? Sometimes people have neck pain and it actually isn't related to the injury, but the fact is that because of pain in other places or their head hurting all the time, they become very stiff and tense, and so they develop neck pain. And they'll tell you that they didn't have neck pain at the time of the injury, but now they have neck pain, which makes their headaches worse. So I think it's important to get a diagnosis of what the actual neck problem is that is giving you problems.
Okay, great. Thank you. We've got someone saying last week's concussion seminar, I don't know when that was. The doctor said that dementia is much more related to other factors, not concussion. Is this true?
Yeah, I think that is completely true. So when we say, that's what I was saying about, when we say that a concussion, brain injury has become a risk factor for dementia, we don't see, like, what's the relationship? You have one concussion. I mean, I would argue that there's nobody on the planet who has never had a concussion, because we wouldn't even know about it. Like when we first learn to walk, we all fall, and sometimes we cry for prolonged periods of time. We have no way of communicating what has gone on. The 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 you know I, I would say the tightest relationship, especially with that chronic traumatic encephalopathy, is really with the repetitive head injuries that occur over years. Okay, so that I would say is a pretty tight relationship. Everything else, um, I would say that you should treat a brain injury like a risk factor. Okay, and so if you look at that list of risk factors for dementia, and there's 14 of them now, right? It includes things like high blood pressure, alcohol use, smoking, sedentary lifestyle, um, uh, loneliness, depression, includes a lot of things. And when you look at the risk, okay, the risk that is related to a traumatic brain injury compared to all those other things, it actually is quite small. And so I tell people who come to me who've had, even the people who've had repetitive head injuries, is okay, if you can't change the fact that this has happened to you, right? But you can modify your life and your lifestyle to include all those things that are good for the brain and could mitigate the fact that this rest factor has occurred. So, for example, we know that aerobic exercise is good for the brain, and we know that sedentary lifestyle is bad for the brain. So, engage in physical activity every day. Make sure you got that 30 to 40 minutes of aerobic exercise in your life. Learning new things is good for the brain. Make sure that you know that this is something that you do every day, that you engage in activities where you're actually acquiring knowledge. They know that being social is good for the brain. They know that alcohol is bad for the brain. The new guidelines tell you to get, two alcoholic beverages or less. So they're right. The point is not to focus on just that risk factor, is to say, okay, well, what do you have control over? And what can you do to alter that risk by focusing on those things that will reduce your risk?
Great, great advice. I think this next one maybe relates to the discussion around CTE. They're saying, do they die sooner? So I guess perhaps individuals maybe with multiple concussions, and then they say lawyers argue this is a way of paying out less.
So yeah, I'm not really sure I understand the question. So
No.
CTE is a neurodegenerative disease that stands for chronic traumatic encephalopathy. It's a disease that is a tau protein, like a tau protein building up in the brain. Um, any person who has a neurodegenerative disease, whether it's CTE, whether it's Alzheimer's disease, Parkinson's disease, your lifespan can be shortened. So I don't know if they mean in that way.
Mhm.
But yeah,
Okay.
yeah,
What is your experience with the use of hyperbaric treatments for concussion?
yeah. I don't have any evidence that they work, so I don't use
Yeah.
them.
Yeah.
Mm.
For balance issues, is vestibular therapy the best therapy?
Yeah. I think if you have balance issues, it would be important to go to a physiotherapist that really has some concussion knowledge. People can be unsteady for different reasons. You probably need a good assessment of your inner ear to see what is the cause, and then have targeted therapy. And I always tell people when they're engaging in this kinds of, whether it's physiotherapy or vestibular physiotherapy or any kind of therapy, is to always, you know, just like if I gave you a medication for your blood pressure and your blood pressure didn't come down after a few months, hopefully you would come back to me and say, hey, I'm taking this and it's not working for me. And, we would have to go back and forth. The same kind of critical approach should be used to physio. I sometimes see people who have been in vestibular physiotherapy for 2 years, and I'm at a loss. I don't really understand what's going on. Physiotherapy should be done for a certain number of weeks. You should be seeing improvement. If not, they should be, trying to figure out what's the problem is. This is not for you to be, doing physiotherapy, vestibular therapy for the rest of your life.
Hmm. Absolutely. Okay, thank you. Someone is asking if it's possible to see the resources again. I don't know if you can pull that up. Otherwise, just so you know, the videos and also the presentations will be available usually about a week after our our presentation. So these are all things that you can access if you go to the Canadian Concussion Center website.
Yeah, maybe that's the best way because there's a lot of
Yeah,
questions.
yeah,
Yeah.
yeah, I think
Okay.
so. Um, Do you treat sleep disorders? And would this be mostly with medication? Are there any non-drug treatments that you would recommend? And when should sleep clinics be considered?
Yeah, great question. So I do treat sleep disorders. And firstly, you have to try to figure out what the problem is. Is it somebody can't get to sleep? Somebody can't stay asleep? Those are different types of therapies that we use. Is somebody, does somebody have a sleep apnea? Do they have disordered sleep? Should they be seeing a sleep clinic? So I readily refer people. I do think that there's good evidence for cognitive behavioral therapy for insomnia. Um, and I see in a lot of my patients that the reason they don't sleep well is they have anxiety and they're ruminating at night. They wake up, in the middle of the night and their brains just take off, and we have to treat that because poor sleep is really bad for your brain. It's bad today because your thinking is not going to be great tomorrow. Your memory is not going to be great. You're going to get worse headaches. Your pain is going to be worse. You're going to be more irritable. But as well, it's not good for you in the long term. Okay. There's lots of evidence that poor sleep can affect your brain decades from now.
Great. Okay, thank you. What, if any, nutritional supplements are best for concussion recovery or long-term symptom management?
I don't really prescribe nutritional supplements. There's not any evidence for concussion recovery. Concussion recovery, I think right now we only have good evidence for aerobic exercise and then targeted therapy for the symptoms that you have. I always tell people eat a well balanced healthy diet. The Canadian Food Guide puts out recommendations, and I think they're important. You need to be healthy, but there is nothing about nutritional supplements that has evidence for to be
Okay,
used.
great. Thank you. Um, what do you think about I'm thinking that maybe they're asking about rides because they comment on Wonderland. Um,
Oh, yeah. I
I'm
mean,
certain.
yeah. I have to admit that I'm a big fan of like fast rides and roller coasters and stuff like that, but I don't know. That's a great question. I never thought about it.
Yeah.
Definitely, if you've had a concussion, don't go there because
Yeah, yeah.
I don't think that would be good. Yeah.
Okay. Um, this person's saying, you mentioned headache medication, but over the counters aren't helping at all. Should I be looking at prescription medications?
Oh yeah. And one thing to worry about over the counter stuff like Tylenol, Advil, all the analgesics, naproxen, meloxicam, all those other ones that are some of them are not over the counter is if you take these kinds of medications for more than 14 days in a month, you will give yourself a medication overuse headache. So you will take a Tylenol, your headache will go away, and then you will get a headache because of that Tylenol. So it's very important. So I urge you to go talk to some practitioner about that.
Great, thank you. The person that was asking about dying sooner, they said, sorry, do people that have had a concussion die sooner?
No evidence for that. And I really hope not. Because I've had them too.
Okay. Um, let's see. Some treatments focus on improving blood flow using a treadmill test to assess. Functional neurology uses this approach. What are your thoughts?
Well, there's the Buffalo treadmill test, I think I'm not sure if that's what you're referring to, and that is a protocol to try to figure out how much exercise you can do before bringing on symptoms. And the exercise, we do think obviously exercise can help your blood flow. Um, but I don't know of a test that is looking to measure your blood flow for exercise. I think it's the aerobic aspect that we want, and do the test to figure out how much exercise can you do before your symptoms come up.
Okay, great. Uh, would a neuro-optometrist be best for a TBI survivor who has eye issues from a car accident, injuries, and whiplash?
Yeah, I'm not actually entirely clear what a neuro-optometrist is. I'm not sure about that specialty, I have to say. I know we have neuro-ophthalmologists. Uh, these are neurologists who specialize in ophthalmology, but I'm not sure what a neuro-optometrist is. So I would, if you have eye if you have eye movement issues, if you see double, if you have blurred vision, you should see an ophthalmologist. That's a medical doctor who looks at eyes, and so that they can figure out what is the problem and then see whether, it's a different type of glasses, if it's, maybe it is some type of therapy, but you need the diagnosis first. And I would, yeah, get it from an ophthalmologist if possible, or a neuro-ophthalmologist.
Okay. We have all kinds of questions coming in, and we have just a few minutes left. Do you ever recommend or have experience with craniosacral therapy for treatment?
No, I don't. Yeah, sorry.
Okay. Um, what professional is best to assess next?
I think physiatrists are good for that. Yeah,
Mhm.
they're the specialists in musculoskeletal.
Okay. Um, this is interesting. 2 months ago, I had four teeth taken out. Does dental work on the upper jaw trigger past brain injury?
Oh, not that I know of. I Yeah, sorry. No,
Okay.
I've
No,
never, I
I
don't
haven't heard of that.
know. I don't know. Leslie, have you?
No, I haven't.
No.
No.
Mm.
Hopefully the removal wasn't too,
Yeah.
you know, involved too much force. Um, okay, we've got someone actually from the US, from Colorado. They're saying, I've had four concussions and also have CFS, chronic fatigue syndrome.
Mm.
I'm planning on doing neuropsychological testing to see areas needing the most attention. Who are the best type of providers to address my cognitive issues? I didn't have much success with speech therapists. Do you do telehealth treatment? And they sort of miss the beginning part of your
Yeah. Well, you will be able to see all of it if you would like, because it will be posted. So I think for your cognitive assessments, though, you would be best served by a neuropsychologist who could do proper cognitive testing to let you know what areas, what areas are weaker, versus areas that are stronger, and maybe even be able to provide strategies for you to help out with that. Yeah, no, sorry, I don't do telehealth. We can't do it outside of even our own province.
Yeah, yeah, that's the problem. Yeah, I would agree with the neuropsychological testing. I mean, occupational therapists too,
Hmm.
certainly in the
Yeah.
setting that I'm working in, not with concussion, but they also may be able to help out. So if you have access to that.
Yeah.
Um, Jim's asking, would intermittent fasting be helpful?
Y- Not that I know of, but I don't, yeah, I don't
Yeah,
know. I don't know
interesting
that there's
question.
any evidence for that. I know some
Yeah,
people who do it, and
yeah,
yeah,
yeah.
not for
Uh,
concussion, but for other things. Yeah.
yeah, yeah. Margaret's asking, I've been told to put myself into situations that can actually trigger symptoms. So, for example, going to supermarkets or driving the car. Do you agree?
Yes, I do. I think that you kind of want to retrain your brain to get back to what it used to do. So, maybe you go in for into a supermarket and you used to stay, I don't know, 20 minutes, half an hour, but you just kind of walk in, walk out, re-expose yourself. A lot of people feel supermarkets are really jarring right after a concussion. And if you have headaches, right, and you're sensitive to light, then they also are jarring. So, obviously, hopefully your headaches are under control, and then you can get back into the supermarket. But yes, I do think people should be re-exposing themselves to all the activities that they used to do before the concussion.
Mm-hmm. Yeah, and Al just commented there's a book actually, Run Towards the Danger. I think that's Sarah Polly that wrote that, that speaks to exposure. Uh,
Right.
excuse me. Um, are you aware of bouldering or indoor rock climbing as a concern in causing concussion?
Well, I think I've only done rock climbing once. I think so I'm not an expert. I think the only thing, obviously, if you fell really, like the jolt when you fall, you could you could get a concussion. But hopefully, you would be doing it safely with somebody that you trust, and not fall. Yeah, but
Yeah,
yeah, if you fell, you could.
yeah, yeah, for sure. How do you learn about suboptimal aerobic exercises?
You know what? There's the Buffalo treadmill test that's actually online. You know what? We'll put the resource. We'll send the. Can we send the resource out? Because there is I think a link to. I think it's called like the BC.
Yeah, I know the Buffalo group has on their website the but probably if you Google like Buffalo concussion uh,
Yeah,
clinic,
and
they've got good resources on that. Um,
and I, but I think there's one that you can actually like administer yourself. Um, you know,
yeah,
So yeah, there is one where you don't need to go into a lab. You just can do it for yourself, and they give you good. But we'll try to find it and put it on. We can try to put it on our website actually.
yeah, yeah, that's a great idea. Um, Aside from implication in a lawsuit, are there practical implications for being diagnosed in a specific category of TBI? So mild versus moderate versus severe.
Yeah, I don't know because I don't know that the research is there. You know what I mean? The problem that we have is there are no biomarkers. So how do I know that yours is mild or moderate? When you think of these repetitive head impacts that have been implicated in neurodegenerative disease, those are without symptoms, right? So even if I say, well, I'm just going to go with your symptoms, I'm not really doing the injury justice because I can't know how severe it is for your brain. So I think right now it's not that useful because it's not precise. If we have biomarkers, then for sure I think it would be useful because that then it'll teach us, right? It might be that if you have one type of injury, you should get this type of therapy, and if you get a different type of injury, it will be a different type of therapy. But we need some precision around that. We need some good markers to tell us that accurately.
Great. Thank you. Okay, we are over time. I will maybe ask one more question and then we will wrap up. I have not been able to tolerate vision PT, so I guess maybe vision therapy. If I
Mhm.
no treatment at all, will I still recover and will it take longer?
Yeah, like I said, vision therapy doesn't really have any evidence right now for concussion. So I would say, better to treat, the symptoms, the other symptoms that may be preventing you from having vision therapy, um, and see where you land. But I don't think that there's evidence that says you need to have vision therapy to get better, because most people actually aren't getting vision therapy.
Hmm.
So, I think it's more about, figuring out what symptoms you do have, targeting those symptoms. And if you have visual symptoms and you can't deal with those right now, well, then, deal with the other ones. And then you probably can work on those other remaining symptoms once everything else is cleared up.
Great. Okay. Thank you very much. That was great. And thank you for all the excellent questions.
Yeah, thank you.
Yeah, we are going to wrap up. I think Christian is going to just pull up uh, a slide or two. Just wanted to thank everyone these were our speakers over the course of our last season of webinars. We're going to be taking a break for the summer and returning in September. So for anyone, if you have already registered for the series, you don't need to re-register. You will receive an update once we have our new schedule put together. Um, and I think that's it. So I thank you again for attending and hope everyone has a great summer. And we will see you back in September.